biggest misconception about kidney cancer is that it is termed a rare cancer, but if you're one of 7,000 people roughly in the United Kingdom who develop it every year, it doesn't seem rare at all. I think the other big misconception about kidney cancer is that there's not much you can do about it. In fact, there's a great deal you can do about it. Most people are cured from kidney cancer by the surgeon. About 2/3 of all kidney cancers can be removed when they're first diagnosed by a surgeon.
I think the biggest problem really is actually knowing that you've got it in the first place, the early diagnosis question. A number of people have subsequently realised that they had bleeding, and either the bleeding stopped and they weren't feeling well, they weren't in pain, and therefore they may not even have gone to their local doctor. And then subsequently, in fact, maybe even as long as 2 years down the line, they realise that they do then exhibit symptoms from secondary tumours that are apparent elsewhere, but that is when they were in really serious trouble with an advanced stage kidney cancer.
The awareness of kidney cancer is quite low amongst the medical profession, and it's not one of the first things that medical people think of when dealing with something like persistent back pain. And the experience of lots of patients, as I say, is very similar to ours, unfortunately. And early diagnosis is one of the very, very important factors in increasing survival rates for kidney cancers.
Kidney cancer is a cancer that affects roughly 6,000 people a year. Half of them probably die. Now, that's a similar amount to the people who are killed on our roads. But the amount of publicity given to kidney cancer, because it's a smaller cancer, is not enough. Now, it is, if like a lot of cancers caught early, treatable. And now, even in later stages, we've got some great drugs that are available.
I think we need to get the message out there. There are all sorts of things to look out for. And my line is quite clear about this. I don't think I'm a hypochondriac, but I think that people should go to their GP if they have any concern at all about any kind of change, maybe in the way that you feel, your weight, the way you look even, bowel movements, all sorts of things. I think particularly men have got to get used to the idea that if there is a change and it's quite significant and it goes on for more than, let's say, I'm not medical, let's say more than a month, go and see the doctor. That's what they're for.